This is a recording on the subject of lifetime customers and chemical imbalances in the brain. And I'm going to start off by saying that the ingestion of cannabis alone can create chemical imbalances in the brain. This chemical imbalance is apparent and obvious when you factor in if you notice you have low motivation, low pleasure, high anxiety, and poor cognition. So the long-term use of cannabis is associated with reduced dopamine levels and can lead to fatigue, low mood, lack of motivation, and it can affect brain development and function. If you go to the doctor and let them know that you're having trouble with your cognition and your motivation, and say you're not motivated to work or go to school, the doctor can prescribe you psychiatric medications such as olanzapine, Zyprexa, which is an antipsychotic. And this is where you become a lifetime customer because that cannabis, the street drugs, might have been easily accessible to you as a teenager. But by the time you're in your mid 20s, those relationships kind of dry up and you end up at the doctor. And the doctor isn't going to necessarily prescribe you cannabis, it might be a pill. And so once you get started on these psychiatric medications, if you try to return to cannabis and go back to it, at that point you have attracted the attention of the authorities. So eventually the citizen or the patient or the target is eventually force medicated with an antipsychotic such as Abilify. This highly disturbing experience causes a loss of ability to sleep because you're so upset and so spooked and frightened. And so then you get prescribed sleeping medications such as a combination of zopiclone and alpha-lorazepam. So these medications are prescribed just so that you can sleep because you've got a chemical imbalance. And the chemical imbalance, I'm not saying that people are born with chemical imbalances or that they by default have them. Rather, those chemical imbalances are are created by ingesting the cannabis and the alcohol early in life. So this is how you become a lifetime customer because the chemical imbalance is caused by the substance use. So it starts off innocently enough with alcohol and cannabis, and this eventually leads to being arrested or incarcerated and force medicated by professional medication. So the nurses and doctors, security guards, they will force inject you with an antipsychotic. The ability to get off the medicine becomes less and less. So a lifetime dependence on medication is caused by easy, cheap access to substances early in life. Then, as you get older and your relationships start to dry up, the chemical imbalance is initiated and is established, and it's further exacerbated by the professional medicines. So, if you stop taking your sleeping medication, you'll notice you're getting brain zaps. A true chemical imbalance has been established. So the insurance company and the drug dealers are the winners in this zero sum game. Don't do drugs. Do not ingest cannabis. Do not indulge in alcohol. Do not make it a habit to do substances because you'll create a real chemical imbalance. And then when you try the psychiatric professional medication, that is even harder to quit, and the chemical imbalance becomes more severe. So what I'm saying is that there are real chemical imbalances, but it's mostly self-inflicted or inflicted by the authorities. Once you're on, it can be very hard to get off. Thank you.